Does Agent Orange exposure have any negative influence on someone's eyes?
Yeah, it's a great question, and it's a question that we get a lot at the VA. The actual exposure to Agent Orange doesn't do anything immediately besides some maybe like ocular discomfort if it gets in the eyes. But long term, as a lot of us know, Agent Orange exposure associated with diabetes. And like we talked about earlier, diabetes can certainly affect the eyes. So if a vet comes in with Agent Orange exposure and I see diabetic changes in his eyes, then at the VA, we know that it is presumed linked to his Agent Orange exposure. And diabetes can wreak havoc on the vision, right? We've talked a little bit about the bleeding, but what exactly happens in diabetic retinopathy? There's two things that can affect someone's vision with diabetes. One, you get these small blind spots. We've talked a lot about this. Certain vascular diseases causes these small blind spots. That's sometimes hard for the patient to notice, like we talked about. A couple pixels burning out, it's hard to register. But when you have enough of those pixels burn out, you start to get real blind spots in someone's vision, and that's difficult. It also causes swelling in the macula. We talked about the macula where all your cones are. And if you have too much swelling, you can see everything okay. The colors seem okay, but I look at your face or I look at the word on the page, and it's almost like someone dropped a drop of water on it. And I can see through it, but it's blurry, it's fuzzy, it's hazy. And then I look around it over here, but there it is in my vision over there, and there it is here, and it just follows your vision. It's always right where you want to look, which is the most frustrating thing. And then there's the end stage of diabetic retinopathy when you can suffer from retinal detachments from diabetes. So any kind of, as you know, and you do a great job on your podcast about talking about the complications of Agent Orange, when it comes into the eyes, it's almost always because of diabetic changes in the eyes that were caused by the exposure.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.